So now we are going to start with the antimicrobials. Antimicrobials means these are the drugs acting against microbes. So what are the microbes that we know? These are bacteria, fungi, viruses and protozoa. So this is what we are going to discuss: antibacterials, antifungals, antivirals, antiprotozoals. So first we will start with the antibacterials. Now if you know the structures of bacteria, you know the classes of antibacterials. Let us see how. So the outermost structure of the bacteria is cell wall, and then inside you have cell membrane, and these round structures are ribosomes, and this is what is nucleoid. So if you want to break the bacteria or kill the bacteria, what you should do? You have to break the structures of the bacteria. So let us see. If we are breaking cell wall, these are known as cell wall synthesis inhibitors. These are first class of drugs. Second is cell membrane inhibitors, second class of drugs. Third class, in the ribosomes, what is happening? Protein synthesis. So we are blocking the protein synthesis. These are known as protein synthesis inhibitor. This is the third class of drug. Now coming to the nucleoid. Inside the nucleoid we have DNA. For formation of DNA we require folate, so you can block folate. These are folate inhibitors. Yes. Now for repairing of DNA we have something known as DNA gyrase. You can block this also. So these are the 5 classes of drugs. That's all. Cell wall synthesis inhibitors, cell membrane inhibitors, next are protein synthesis inhibitors, folate inhibitors and DNA gyrase inhibitors. Now how do these antibiotics work? It can work via 2 mechanisms, either static or cidal. Cidal means it is killing. Static means it will stop replication of bacteria. It will stop the replication of bacteria. This is the meaning of static. That's all. So there are these 5 classes: cell wall synthesis inhibitors, cell membrane inhibitors, protein synthesis inhibitors, folate inhibitors and DNA gyrase inhibitors. Now how to remember which are static and which are cidal? Now how to remember this? See, to stop aging of your skin, what do you generally apply? You apply SPF. No, that is what is sunscreen. So see here carefully. S means static, P means protein synthesis inhibitors, F means folate inhibitors. So protein synthesis inhibitors and folate inhibitors are static. That's all. All the remaining drugs are cidal. Now we have some exceptions in this. We'll study in their respective classes, but easy way to remember is SPF. What are static? Protein synthesis inhibitors and folate inhibitors. Yes, we are done with the classes. Now first let us start with cell wall synthesis inhibitors. In cell wall synthesis inhibitors, the first class of drug that we have is beta-lactam. How does it work? It works by blocking the cross-linking. That is what is known as transpeptidase. Yes, in this we have penicillins, cephalosporins, carbapenems and monobactams. So you can write it or remember it as PCM. So P is for penicillin, C is for cephalosporin and carbapenem, M is for monobactam. That's all. So these are the drugs in beta-lactams. So first let us start with penicillins. What is the drug of choice in neurosyphilis? It is penicillin G. This is the aqueous form. Now if you remember benzathine penicillin G, it is used in rheumatic fever prophylaxis as well as syphilis treatment. These are 2 important things that you need to know about penicillins. Now coming to Jarisch-Herxheimer reaction. Do you know what is this? You must have studied in microbiology. Jarisch-Herxheimer reaction. When you give penicillin to a person who is having syphilis, what will happen? It might cause worsening of the skin lesions. Yes, it might cause fever, myalgia, decreased BP, increased heart rate. Why is this happening? This is happening because of spirochete lysis. Why? Syphilis is due to spirochetes. Now these spirochetes will start dying and it will produce a immune response. It will cause cytokine release. That is why you see all of these things. That is what is known as Jarisch-Herxheimer reaction. Yes. Now we'll see about the resistances in the penicillin. Now we have something known as methicillin resistant Staphylococcus aureus. Now what is the drug of choice for MRSA, it is supposed to be vancomycin. The drug of choice for MRSA is vancomycin. Now, if the bacteria becomes resistant to vancomycin itself, it is known as VRSA. Now, what is the drug of choice for VRSA? It is daptomycin. It is daptomycin. But if you see VRSA pneumonia, that means if there is a pneumonia that is caused due to vancomycin resistant Staphylococcus aureus, can you give daptomycin? No, you cannot give daptomycin because lungs have surfactant and surfactant inactivates this daptomycin. So, in the lung you have to give linezolid. L for L, remember it this way. L for L. In the lung you will give linezolid. That's all. MRSA, vancomycin. VRSA, daptomycin. VRSA in lungs, linezolid. That's all. Now, if you see in the penicillins, maslocillin, azlocillin and piperacillin. Yes, all of these are effective against Pseudomonas. But what is important is vancomycin is not effective against Pseudomonas. Please remember this much. Vancomycin is not effective against Pseudomonas. That is what I want you to remember. Now, coming to cephalosporins. Cephalosporins, the drug of choice in Pseudomonas is ceftazidime. It is ceftazidime. For typhoid, it is ceftriaxone. For typhoid, it is ceftriaxone. And in the surgical prophylaxis, you will give cefazolin. So, ceftriaxone is a third generation. Cefa means cef is given, that is a cephalosporin. A means the first letter, so this is the first generation. Now, cephalosporins are usually not given in renal failure because they can aggravate the renal failure and because these cephalosporins are excreted through kidney. Now, if you see here, there are some drugs that are being excreted in bile as well. These are ceftriaxone and cefoperazone. If they are excreted in bile, they will go into the intestine and they will be excreted through feces. That is why these are safe in renal failure. Now, there are some cephalosporins that will cause disulfiram-like reaction. This we have studied in the CNS. What is it? Cefoperazone, cefotretone and cefomendol. When there is disulfiram-like reaction, it will cause increased heart rate, it will cause palpitations, it will cause anxiety-like symptoms and all of these. Anxiety-like symptoms. You see all of these with disulfiram-like reactions. These are the drugs that cause it. Most important drug that is usually asked in the exam is metronidazole. We'll talk about it when we are studying metronidazole. But what I want you to remember is metronidazole will also cause this disulfiram-like reaction. So, that's all about the cephalosporins. Now, coming to the next class, that is carbapenems. In carbapenems, I just want you to remember one word, that is cis. Cis means, C for carbapenems, this much you already know. I for imipenem. Now, what are the side effects of imipenem? S for seizures. It will cause seizures. Now, imipenem is metabolized by something known as renal DHP, that means renal dihydropeptidase. This will inactivate imipenem. If you want to block renal DHP, which drug would you give? You will give cilastatin. Yes, why? Because cilastatin will block the renal DHP and it will increase the effect of imipenem. That's all. So, this is what I want you to remember. Okay, so you see here side effects of carbapenem are seizures. That is why it is contraindicated in epilepsy. Now, these seizures are maximum in imipenem. That is why I gave you the mnemonic cis. That's all, it finishes carbapenems. Next is monobactam. Now, why are these known as beta-lactam antibiotics? Beta-lactam antibiotics. All of them have beta-lactam ring and it also has a side chain. Now, in monobactam, it only has one ring, it only has beta-lactam ring. It has only beta-lactam ring. There is no side chain. Now, all these three drugs has side chain. Because of side chain, it causes penicillin allergy. So, if a person is allergic to penicillin, he will also be allergic to cephalosporins, he will also be allergic to carbapenems. Why? Because there is side chain in all three of them, but there is no side chain in monobactam, so it will not cause allergy. That is why it is known as no cross allergy with penicillins. So, they will ask you in the question which beta-lactam has no cross allergy, that is what is monobactam. It is also, the drug name is astrionam. That's all. Done. Now, we are done with beta-lactams. Next class is glycopeptides. In glycopeptides, we have something known as vancomycin. What are the side effects of vancomycin? It will cause red man syndrome. Red man syndrome. You can see in the name itself, N for nephrotoxicity, O for ototoxicity. It will cause nephrotoxicity and ototoxicity. Now, the other classes of drugs are bacitracin, cycloserine and phosphomycin. Bacitracin can be used in MRSA nasal carriers. Cycloserine, what are the side effects? S for seizures. It will cause seizures. Cyclo, it will also cause psychosis. You can remember it as psychosis. That means psychoserine. Yes, instead of cycloserine, you can remember it as psychoserine. So, psycho means psychosis, serine, SE for seizures. That's all. Phosphomycin can be used in UTI. These are all cell wall synthesis inhibitors. Only in beta-lactams you have 4 classes. What are they? Penicillin, cephalosporin, carbapenem and monobactam. So, you can remember it as PCM. That's all. Now, coming to cell membrane inhibitors, we have 2 of them. What is most important to us is daptomycin. Daptomycin is drug of choice for Varsa. This much you already studied. Now, there is a superbug that is known as NDM1 beta-lactamase. NDM1 beta-lactamase, for this the drug of choice is colistin. This is also cell membrane inhibitor. So, remember colistin and daptomycin in cell membrane inhibitors. So, we are done with cell wall synthesis inhibitors, cell membrane inhibitors. Next is protein synthesis inhibitors. Protein synthesis inhibitors. Now, where do protein synthesis happen? Where does protein synthesis happen? In the bacteria, it happens in ribosomes. Now, how many subunits do we have in the ribosomes? It is 30S and 50S. It is 30S and 50S. Now, I told you a very good story in the class to remember all of these subunits and how to remember the drug classes and how to remember the mechanism of actions. Yes, now we don't have enough time to do all of that, but I'll give you a quick recap. Yes, let us see. Drugs acting on 30S, I asked you to remember as 80 drugs. Yes, drugs acting on 50S, I asked you to remember it as OCPMLS. OCPMLS. We will see what all of these are. Yes, 80. Drugs acting on 30S subunit, A for aminoglycoside and T for tetracycline. Okay, I told you protein synthesis inhibitors are SPF. It is static. SPF you get in 30 and 50 concentration. No? So, you can easily remember SPF 30 and 50 protein synthesis inhibitors are acting either on 30S or 50S. This is how you can remember. In 30S you have ANT, in 50S you have OCP-MLS. Now, in the 30S, coming to aminoglycosides. Aminoglycosides act by misreading of mRNA. So, it will cause production of abnormal proteins. These are toxic to cells and they will kill the cells. So, only drug that is cidal in protein synthesis inhibitors are aminoglycosides. These are cidal. They will have the name mycin in them. Mycin, amikacin, gentamicin, streptomycin, kanamycin, all the mycins are aminoglycosides. What are the side effects of this? You see here carefully, again it is given in the name amino, N and O. It will cause nephrotoxicity, it will cause ototoxicity, and N and M, it will cause neuromuscular toxicity. It will cause neuromuscular toxicity. Maximum nephro and neuromuscular toxicity is caused by neomycin. It is given in the name itself, neomycin, N for N. So, this is about aminoglycosides. I want you to remember. There is a drug called streptomycin. Streptomycin is drug of choice in rabbit fever. What is rabbit fever? It is tularemia. It is tularemia. That's all. Now, coming to the tetracyclines. Tetracyclines block the A site. I asked you to remember A and T. So, tetracyclines will work by blocking the A site. This is how you can remember. Now, what are the drugs in tetracyclines? All the cyclines are tetracyclines. Yes. So, any drug you see by the name cyclines are tetracycline. Doxycycline, minocycline, tetracycline, oxytetracyclines, all of these. Now, how do we remember the side effects? I told you, you remember it with A, B, C, D, E, F. These are the side effects. With A, it will cause acute renal failure. Acute renal failure. Now, B, it blocks the bone growth. It blocks the bone growth. With C it will cause catabolism. D. Diabetes insipidus. E. Ear dysfunction. Ear dysfunction. What is important in all of this is F. F, it is Fanconi syndrome. F, it is Fanconi syndrome. How do you have Fanconi syndrome? Whenever you take an expired tetracycline, it will cause Fanconi syndrome. Please remember this. Now, in acute renal failure, which tetracycline is safe? They will ask you. That is doxycycline. Doxycycline is safe in acute renal failure or patient with renal failure. Which tetracycline can you use? You can use only doxycycline. Now, coming to the drugs acting on the 50S, these are OCP, MLS. First, we will see MLS drugs. M means macrolide, L means lincosamide, S means cryptogrammin. Now, all these drugs will block something known as translocation. All these drugs will block translocation. If you see here carefully, macrolides, these are macro. So, this is azithro. The drug is azithromycin, macrolide, azithromycin. Now, macrolide, remember this, macro, RO, azithromycin, RO. Romycins are macrolides. Mycins are aminoglycosides, but romycins are macrolides. Yes, easy way to remember this. Now, so what are the side effects of macrolides? It is given in the name itself. You can see macro. Macro is the side effect. Now, what is important in this macro? Not everything is important for us. In macro, at least remember R and O. It will cause reversible ototoxicity. It will cause reversible ototoxicity. This is about macrolides. Yes. Now, coming to lincosamides. See here, CLIN. It was clindamycin. What is the important side effect of clindamycin? It will cause something known as pseudomembranous colitis. It will cause pseudomembranous colitis. Now, you tell me what is the drug of choice or the best drug for pseudomembranous colitis? It is fidaxomicin. It is fidaxomicin. Now, what is the important side effect of clindamycin? It is pseudomembranous colitis. The drug of choice is fidaxomicin. Coming to streptogrammins, we have two drugs, that is vinpristin and dalfopristin. Vinpristin and dalfopristin. How can you remember this? You can remember it with the easy mnemonic DQS. That is Dulkar Salman. No? D for dalfopristin, Q for vinpristin, S for streptogrammins. These are streptogrammins. Yes, MLS is done. It is blocking the translocation. Now, coming to OCP. OCP means oxazolidinones. Yes, it blocks the initiation. C and P, chloramphenicol, fluoromutilins. They will block peptidyl transferase. Yes. Now, what is oxazolidinone? It is linezolid. It is linezolid. What are the side effects of linezolid? Not really important, but one thing I want you to remember is it can cause cheese reaction. It can cause cheese reaction. Why? Because it is a MOV inhibitor. It will cause cheese reaction. Drug of choice for cheese reaction, I already told you, it is phentolamine. Now, coming to chloramphenicol, this is what is important. Chloramphenicol will cause grey baby syndrome. All of you must remember this. It will cause grey baby syndrome. Colors are really important. They will ask you. Purple toe syndrome, I told you. Yes, it is warfarin. Purple glove syndrome, phenytoin. Grey baby syndrome, this is chloramphenicol. Fluoromutilins, it is lefamulin. The side effect is QT prolongation. It will cause QT prolongation. That's all. So, we are done with protein synthesis inhibitors as well. Next, what is left? These are antifolate drugs. Antifolate drugs. Now, how is the active form of folic acid formed? Yes, pyridine plus PABA will combine together to form DHFA, and DHFA will form tetrahydrofolate or folinic acid. This is the active form. For formation of this, you need DHPS enzyme and DHFR enzyme. DHPS, S for S, can be blocked by sulfonamides. DHFR will be blocked by drugs like methotrexate, trimethoprim, pyrimethamine. How do you remember this? Remember this as MTP. Why? If you block DHFR, what will happen? Folic acid will reduce. If folic acid will reduce, what will happen? It will cause neural tube defects. If there is neural tube defects, what will you do? MTP. That is why remember it as MTP. Methotrexate, trimethoprim and pyrimethamine. That's all. Now, sulfonamides, we have silver sulfadiazine. This is drug of choice in burns. Yes, diazine means diya, lights. When you go too near to the lights, it will burn yourself. So, silver sulfadiazine can be used in burns. How to remember sulfonamides? All of them will have sulfa in their name. Sulfadoxin, sulfdiazoxin, sulfoxamethasone. All of these are having the name sulfa in them. These are sulfonamides. Now, dapsone. Dapsone is also a sulfonamide, but it does not have sulfa in the name. This is what I want you to remember, dapsone. Dapsone is drug of choice in leprosy as well as dermatitis herpetiformis. Dermatitis herpetiformis. Now, what is the side effect of this? The side effects of this, the most important things to remember are, it can cause kernicterus. It can cause kernicterus. It can also cause SLE. Which SLE? Drug-induced SLE. Drug-induced SLE. I already talked about this in the general pharmacology chapter. Any drugs that are undergoing slow acetylation, in these slow acetylators will cause drug-induced SLE. I call them as SHIP drugs. Now, coming to DHFR blockers, we have methotrexate, trimethoprim and pyrimethamine. Since it is decreasing the folic acid, it will cause neural tube defects. Now, what is the drug of choice for toxoplasmosis? Drug of choice for toxoplasmosis, it is sulfadiazine plus pyrimethamine. Pyrimethamine. This is the drug of choice. But in pregnancy, you cannot give this because they are contraindicated. In pregnancy, you will give spiramycin. Spiramycin. Now, there is something known as cotrimoxazole. Yes. Now, here you mix two drugs. Which two drugs? See here, trime or trim. You are mixing trimethoprim. You are mixing trimethoprim with oxazole. This is sulfamethoxazole. Yes, sulfoxazole. So, you are mixing both of them and it will form cotrimoxazole. That is what is given. Co means two drugs are combined together. When two drugs will combine together, it will cause sidal effect. Yes, so this is the only drug that is having sidal effect in the antifolate. That is what is cotrimoxazole. Cotrimoxazole is sidal. This is one exception. Aminoglycoside is sidal in protein synthesis inhibitor. Okay. Now, coming to the last class, that is DNA gyrase inhibitors. So, if we block DNA gyrase inhibitors, the replication is not happening. The DNA will die and the cell will die. Got it? So, here the drug names are fluoroquinolones. These drugs are fluoroquinolones. How will you call them? These are floxacins given in the name. Fluorofloxacins. Yes, what are respiratory fluoroquinolones that you must know? These are levofloxacin, moxifloxacin and gemifloxacin. These are very important. Okay. Now, ciprofloxacin is the drug of choice for prophylaxis of meningococcal meningitis. What is the drug of choice for empirical treatment? Empirical treatment is ceftriaxone. Okay. But in pregnancy, you cannot give ciprofloxacin because it is contraindicated. So, again in pregnancy, you will give ceftriaxone even for prophylaxis. Yes. Now, what are the side effects of fluoroquinolones? You can remember it with the help of PQRST. Yes. P for peripheral neuropathy, Q for QT prolongation. Yes. R for rash, S for seizures, T for tendinitis. It can cause inflammation of tendons. Yes. So, that's all. Maximum QT prolongation and maximum seizure risk is seen with moxifloxacin, M for M. Yes, please remember this. And MTP, moxi, trova and pfloxacin, these are safe in renal failure. Renal failure. You can see here at the end I have given you antibacterials that are safe in pregnancy. What is the most safe drug in pregnancy? It is PCM. So, you can remember it that way. These are penicillins, cephalosporins and macrolides. Macrolides are also alternative to penicillins. What are the antibacterials that are safe in renal failure? All of them I have given. We have discussed two most important ones, ceftriaxone and cefoperazone. Clindamycin also. All of them are secreted through bile. At least remember these three. These are safe in renal failure. Got it? Safe in pregnancy are PCM, penicillins, cephalosporins and macrolides. Yes. So, now we are starting with the TB treatment. Now, the regimen of TB is HRZE for 2 months, HRE for 4 months. Now, why are we excluding Z, that is pyrazinamide, for the next 4 months? Because this is very hepatotoxic. That is why we give it only for 2 months. Did you understand this? So this is the basic treatment of TB. So you see here, H is for isoniazid, R is for rifampicin, Z is for pyrazinamide, E is for ethambutol. What is important here? The side effects are very important. Now, first we will start with the isoniazid. It will block the mycolic acid synthesis. Okay. Now, we will have resistance to isoniazid if CATG gene is reduced. CATG gene is reduced, we will have resistance. Please remember this. Now, isoniazid will decrease vitamin B6, that is also known as pyridoxine. That is also known as pyridoxine. Because there is reduction in pyridoxine, it will cause something known as peripheral neuropathy. Yes, it can cause memory issues. It might even cause seizures. So these are the side effects I want you to remember with isoniazid. How can you remember pyridoxine? See, iso means isolated person. For isolated person, what you don't have? See, pyri means pyar. Isolated person को प्यार नहीं मिलता है. This is how you can easily remember isoniazid. The pyridoxine is getting reduced. Because of this, he is having peripheral neuropathy, memory issues, and sometimes seizures as well. Now, coming to rifampicin. Rifampicin, remember the secretions. It will cause orange secretions. Yes, there will be orange tears, orange urine. Yes, all of these are seen with rifampicin. It is also an enzyme inducer. If it is an enzyme inducer, what will it do? It will cause a drug failure. That is what we have studied in G Pharma. Yes. Now, coming to pyrazinamide, I've already told you it is hepatotoxic. Now, ethambutol, E for E, it will cause eye problems. That means it might cause optic neuritis. It will also cause color blindness. Which color blindness will it cause? It will cause red-green blindness. Red-green color blindness. That's all. Now, there is something known as MDR-TB. MDR-TB means multi-drug resistant TB. Here, the person is resistant to both isoniazid and rifampicin. And if the person is more than 14 years of age and if he is having MDR-TB, we will give a regimen that is known as BPAM regimen. BPAM regimen. This is very important. B for bedaquiline, PA for pretomanid, L for linezolid, M for moxifloxacin. At least remember bedaquiline. This is where the questions are most commonly asked. Q for Q, it will cause QT prolongation. Now, it works by blocking the mycobacterial ATP synthesis. These are the questions that have been asked on bedaquiline. Very important to remember. L for linezolid. M for moxifloxacin. PA for pretomanid. This is what I want you to remember. Now, coming to leprosy. How do I remember the drugs in leprosy? I recall it like this. I study a line called leprosy is a recurrent and chronic disease. Yes. See, R for rifampicin. C for clofazimine. D for dapsone. What is the drug of choice in leprosy? It is dapsone. Now, we have two kinds of leprosy, paucibacillary and multibacillary. For paucibacillary, you have to treat for 6 months. For multibacillary, you have to treat for 1 year. Now, what is the exact treatment? We will see. First, you have to give rifampicin and clofazimine. So, remember one dose, 600 mg for rifampicin, you divide by 2, it will become 300 for clofazimine. Okay. So, rifampicin 600 and clofazimine 300, you have to give it to the patient in front of you. He has to take those tablets in front of you. Yes, that is what is known as supervised. So, you give it once, okay, in the first day of the month. Now, after that, he goes back home and he takes dapsone and clofazimine. Again, remember 100 mg, 100 by 2 is 50. Okay, dapsone and clofazimine. Now, he takes this daily for 28 days. That's all. 1 month is done. 1 day he is taking supervised therapy, 28 days he is taking unsupervised therapy. So, this is 1 month treatment. Now, if a person is having paucibacillary, he should do it for 6 months. If a person is having multibacillary, he should do it for 12 months. That's all. Now, what is the drug of choice for lepra reaction? These are steroids. That's all. Now, coming to the fungals, antifungals. What is most important in antifungals is a drug called amphotericin B. We will talk about this. See, amphotericin B works by blocking the or breaking the cell membrane. How does it break? It binds to something known as ergosterol. Cell membrane of fungus will have ergosterol. It will bind to ergosterol. It will form a pore, and because of these pores, the cell will die. This is what is amphotericin B. Okay. Now, there are many other antifungals, but for the exam, please remember amphotericin B. Now, let us see this. Now, a person who was happy before has been diagnosed now with AIDS. So, obviously, he got unhappy. You can see in the image. Now, when the doctor checked his CD4 counts, his CD4 counts are less than 100. So, he thought he might get TB, and he has started him on INH prophylaxis. What is the meaning of INH? It is isoniazid. Now, since he is sad, he went to a park, he is sitting there. Now, he started seeing pigeons and he started feeding all these pigeons. Now, after this, he started having fever, headache and neck rigidity for more than 2 weeks. Yes, he waited for 2 weeks, it did not reduce. So, he understood there is something wrong and he went to Kasturba Medical College, that is KMC. Once in KMC, they have understood that the person is having meningitis. And once they have done the CSF sample, this is how it is looking. Look carefully, this is a spotter image. Everything that I told you is a question. Yes, it is India ink stain. What do you see here? Encapsulated budding yeasts. Did you understand this much? Now, what is this? What is the most common cause of meningitis in HIV? You should have known the answer. If you don't know what is this India ink staining, it is because of an organism called Cryptococcus neoformans. So, the most common meningitis in HIV is cryptococcal meningitis. What is the drug of choice for cryptococcal meningitis or Cryptococcus neoformans? It is IV amphotericin B. Plus flucytosine. You have to give both of them. After this, it should be followed by fluconazole. This is the entire treatment for Cryptococcus neoformans. Now, what is important to us is IV amphotericin B. So, you write here the drug of choice is IV amphotericin B. Now, how does this act? It binds to the ergosterol and forms pores on the cell membrane. The drug of choice. This is the amphotericin B is the drug of choice in which conditions? It is drug of choice in Kala-Azar, mucormycosis. Yes, you might have seen this so many times after the COVID, people are using amphotericin B, and Cryptococcus. That is what we have just studied. So, if you see the story, remember this carefully. KMC is the drug of choice. K means Kala-Azar, M means mucormycosis, C for Cryptococcus. That's all. Now, what are the side effects of this? It will cause infusion reactions. Again, nephrotoxicity and hypokalemia. This is how you can remember INH. You see here INH. So, everything in the story is important. How do you get Cryptococcus neoformans? From pigeon droppings. You can see pigeon droppings here. If a person is having AIDS, he can have TB. So, he started on INS prophylaxis. Yes, the most common cause of meningitis in HIV is Cryptococcus neoformans. In this, we do India ink staining. All of these are questions, PYQs. Yes. Now, how do you prevent this nephrotoxicity? Obviously, you can preload the patient with saline. You can give 1 to 2 liter of normal saline. If this is not working, then you change amphotericin B. You don't give amphotericin B, you give liposomal amphotericin B. Yes, this is nephrosafe, renal safe. Now, coming to the viruses, we are finished with the fungals. Coming to the viruses, the most important one is HIV. When a person has HIV, what is the treatment? It is HART. It is antiretroviral therapy. Now, in any patient, you have to give HART lifelong. You have to treat them for their entire life. How do you treat HIV? See, you have to limit the HIV now. So, I remember it as limited, LTD. Now, if a person is more than 10 years, what are LTD drugs? It is lamivudine, tenofovir and dolutegravir. Now, if an infant is born to HIV mother, to prevent the Perinatal transmission or vertical transmission, what drugs will you give? If a baby is at low risk means the mother is already taking ART, so the baby is low risk of getting the HIV. So in this baby you will give syrup nevirapine. Now, if the baby is at high risk, that means the mother is not using any ART, the baby is at high risk of getting HIV. So in this patient, you will use syrup nevirapine along with zerovidin. You have to give zerovidin as well. Let us suppose if the baby's mother is already exposed to nevirapine, that means she has used nevirapine before, then you will give zerovidin. These are the most important things about the treatment of HIV. Now, coming to post-exposure prophylaxis, let us suppose somebody has drawn blood from the HIV patient and with that needle you got pricked. That is what is known as needle prick injury. Or if there is any needle prick injury, what you should do? You should start LTT treatment within 1 month. You should start LTT treatment for 1 month. Yes, LTT you already know, lamivudine, tenofovir, dolutegravir. You have to give it for 1 month. But when should you start this? You should start this within 2 to 72 hours of exposure. As soon as the needle prick injury happens, within 72 hours you have to start LTD and you should use it for 1 month and get it tested for HIV. Now, HIV with TB. What should you treat first? You should treat TB first always. ATT is first, then you should treat AR. Did you understand this much? Now, why not ART? If we treat HIV first, it will cause something known as IRIS. Immune reconstitution inflammatory syndrome. This is what is happening. Now, coming to the anti-protozoal drugs. In this, the most important one is malaria. We have 2 kinds of malaria, uncomplicated and complicated. See, in severe or complicated malaria, the drug of choice is simple. It is IV artesunate. That means there is brain involvement, there are seizures and stuff. This is what is complicated or severe malaria. Coming to uncomplicated malaria. In India, it can be caused either due to Vivax or falciparum. Now, in Vivax, what is the treatment? It is chloroquine. In adults, what about pregnancy? It is also chloroquine because it is safe in pregnancy as well. Now, coming back to falciparum, it is ACT. ACT means artemisinin combination therapy, but this is not safe in pregnancy. That is why in the first trimester you cannot give ACT. So what will you give? You will give quinine plus clindamycin. Second and third trimester organogenesis has already happened, so you can still give ACT. So how do you remember all of it? See, how do you clear a viva? By answering it correctly. Yes, so viva is cleared by facts. So this is how I remember. Viva means Vivax, C is for chloroquine. So Vivax is chloroquine. Facts. F is for falciparum and ACT is for ACT therapy. So falciparum, ACT therapy, Vivax, chloroquine. That's all done. Now coming to the ACT therapy. How do you give ACT therapy? ACT therapy, in northeastern states, you give artemether and lumefantrine. We can call it as NEEL. Northeastern states, artemether, lumefantrine. In rest of Indian states, rest of all the other states, you will give artesunate, sulfadoxine plus pyrimethamine. If you remember, sulfadoxine plus pyrimethamine plus artesunate is the ACT therapy. Yes, if you remember from the previous thing, we have studied sulfadiazine plus pyrimethamine is for toxoplasmosis. Here it is sulfadoxine plus pyrimethamine. Yes, so rest of India you can remember it as ASP. It is ASP. That's all. So for prophylaxis, what should you do? For prophylaxis, if the person is traveling for less than 6 weeks, you should give doxycycline. If the person is traveling for more than 6 weeks or 6 weeks, you should give mefloquine. Why? Doxycycline has to be given daily, mefloquine can be given weekly. That is the reason why for long-term travel we use mefloquine. Now, how do you give this? Before the travel, you have to give at least 2 doses and you have to continue throughout the travel. After coming back also, you should treat them for 4 weeks. That's all about malaria. Now, coming back to amoebiasis. In any symptomatic cases of amoebiasis, that is due to entamoeba histolytica, you will give something known as metronidazole. Metronidazole is nitroimidazole. So we are going to see metronidazole here. Now, metronidazole, you can see this is the mnemonic for all the uses of metronidazole. Go get in a metro. Go get in a metro. When you see a metro, go get in a metro. See, G for go. It is Giardia. Another G, it is Gardnerella vaginalis. It will cause a bacterial vaginosis. Very important question from your gynecology. Bacterial vaginosis, Amsel's criteria, clue cells, all of this. Yes. Get. E for Entamoeba histolytica. This we already talked. It is amoebiasis. T. T for trichomoniasis. It will cause a strawberry cervix. Strawberry cervix. Now, IN. A. Infradiaphragmatic anaerobes. For supradiaphragmatic anaerobes, the drug of choice is clindamycin. For infradiaphragmatic, it is metronidazole. I told you the most important side effect of metronidazole. What is it? It is going to be disulfiram reaction. It is going to be disulfiram reaction. That's all. That's all about amoebiasis. Now, only one thing is left, that is antihelminths. Antihelminths. Most common one I want to say is platyhelminths. What are platyhelminths? See here. For platyhelminths, the drug of choice is praziquantel. At least remember this much. Praziquantel. Yes. For the remaining ones, it is albendazole.